So antibiotics are actually considered to be miracle drugs. And the reason why they're considered to be miracle drugs is that they have saved millions of people over the years. Now, there's a lot of medical technologies, a lot of medical procedures that were not possible if it were not for antibiotics. And some of them were bone marrow transplants. We're talking about things like organ transplants, stem cell transplants, chemotherapy. All of these things would not be possible if it were not for antibiotics. Because when you do all of these procedures, what happens is that it decreases it decreases the immune system, and you need those antibiotics to go ahead and solve a lot of these problems. Now, what's interesting is that Stuart Levy, in terms of bacteria and resistance, he went ahead and he wrote a paper in Scientific America just a few years ago. And what he's shown in that paper was that there was a report where there was one household member and they were on antibiotics for long term. So as you know, when you're on antibiotics for long term, that's going to create resistant strains. What's interesting is that they went ahead and they cultured the other members of the household, and they found that those other members of the household had the exact same resistant strains on their skin. But they weren't even taking the antibiotic. So how is that possible? Resistance spreads. And just what Dr. Mashoda said earlier, resistance is very, very important, and resistance is a huge problem. And you think, well, maybe this is all systemic disease and everything like that. Does it really involve an eye care practitioner? Yes, it does, because there are very many instances where resistant strains have come to affect the eye, causing corneal infection, causing keratitis. What are some of the examples? Well, the first one that's been around for a while is MRSA. MRSA, there are reports, especially post-LASIK by Solomon in 2007, shown that there are a lot of cases where he identified MRSA as the cause of the corneal infection. What is the other type? Well, the other type is kind of like the sexy new resistant strain, superbug, multi-drug, multi-class resistant strain, and that's the gram-negatives. And we're talking about the gram-negatives, I mean more closely, and most ODs will identify this. ODs that fit contact lenses, extended wear, so on and so forth. It's resistant strains with Pseudomonas. All right, so let's take a look at MRSA. Well, with MRSA, actually, one of the Sotozono went ahead and picked out 4 different classes of what you'll see with MRSA keratitis or MRSA infection in the eye. The first one is conjunctivitis only. This is something that I've seen, something that I've experienced. The second one is actually a corneal epithelial defect with superficial infiltration. The third class, or the third step in this progression, is keratitis with a corneal ulcer, or with an ulcer and stromal infiltration. And finally, the worst off, the final stage is corneal perforation. So MRSA, as I said before, has been around a while, and there's been many reports. Now, the other one we talked about was actually gram-negative resistant, and that would be Pseudomonas resistant. So what are we talking about there? Well, there was a report by Oldenburg. So Oldenburg had identified 89 cases in India where there was 4th generation fluoroquinolone resistance, more specifically to moxifloxacin. And what's interesting is that with the 4th generation, prior to that, we had 3rd generation fluoroquinolones. 3rd generation fluoroquinolones are known as what? Corneal specialists in a bottle. Well, they were no longer effective because of this resistance problem, so they came out with 4th generation fluoroquinolone. And what happened is that now we have resistance to that. So resistance continues to be a problem, and in that case study or case series that they had, there was resistance for what? Which gram-negative? Pseudomonas. The contact lens, the one that we are all familiar with, that is the bug that causes the corneal ulcers, extended wear, so on and so forth. Vazirani went ahead and showed that there was actually 90 cases to multi-class or multi-drug resistant Pseudomonas. He even went ahead and identified it as MDRPA. So what's happened is that he went ahead and covered as to what was the consequences of the corneal ulcer or the Pseudomonas, and he found that 52% of these patients actually went to corneal perforation. So I think that for optometrists, we have to be highly, highly concerned about resistance because it does affect our patients and it does affect the eye.